Imagine struggling to breathe every day, yet you have no idea what's causing it. For millions of people worldwide, this is the reality. Chronic obstructive pulmonary disease, or COPD, is the fourth leading cause of death worldwide, and experts fear it could climb to third within just a decade. But here's the problem. Far too many people don't even know they have it. Welcome back to my channel. I'm your Devi, mind body consultant with professional background in respiratory physio, psychotherapy, hypnotherapy, and neuroscience. In this video, I'm going to talk about something that affects millions but is often misunderstood: COPD diagnosis. Before I dive in, there's something special. This week, that is starting from the 9th of March to the 15th of March, we teletherapies joined the American Association of Cardiovascular and Pulmonary Rehabilitation to celebrate this Pulmonary Rehab Week. This video about COPD is one of the major conditions offered pulmonary rehabilitation, and mostly during their severe or very severe stages. And this video is to create awareness about the diagnosis and misdiagnosis of COPD, and also what are the other challenges in COPD, getting the right care and right lung rehabilitation care, including early diagnosis, mental health interventions, and early referral to lung rehabilitation. COPD, the chronic obstructive pulmonary disease, is a condition that makes it harder to breathe and it's on the rise. But why are so many people not getting diagnosed, or worse, misdiagnosed? In UK, COPD ranks the fifth leading cause of death. The Royal College of Physicians reports that over 1.2 million people in UK are living with diagnosed COPD. But there are likely hundreds of thousands more who haven't been diagnosed yet, and the numbers are expected to rise. Experts predict that within the next decade, COPD will become the third leading cause of death in the UK. So what's going wrong with COPD diagnosis in UK? How are so many people being missed, and how are some being wrongly diagnosed? Let's dive into the details. The main reason for COPD misdiagnosis lies in the inconsistencies of diagnostic criteria. But not all regions across UK have equal access to this life-saving test, and not all doctors use it consistently. Studies show that up to 40% of people with COPD in UK may not have been diagnosed due to lack of poor testing. And it gets even trickier. The criteria to define your airflow obstruction is based on the two values. One is the FEV1 and the other one is the FVC, and the ratio of these two, and it can vary. So what is FEV1? FEV1 is a fancy term for forced expiratory volume in 1 second. This relates to how much of air you can forcefully blow out your lungs in the first second after taking a deep breath. And FVC stands for forced vital capacity, which is the total amount of air which you can blow out of your lungs after taking a deep breath. So why does this matter? Normally, when you're healthy, you should be able to blow out a larger portion of air in the first second. In fact, the ratio FEV1 to FVC is usually around 0.7 or higher, meaning that you can expel about 70% or more of your air in the first second. But for someone with COPD, chronic obstructive pulmonary disease, this can be a lower value, less than that 70%. And that's because their lungs are often blocked or narrowed, which makes it harder to get that air out quickly. So if the ratio falls below 0.7, it can be an indicator the person might have a COPD or another obstructive lung disease. Spirometry is a key test the doctors use to diagnose and understand the severity of the COPD, as it shows how well the lungs are working when it comes to getting your air out. Why it matters? Only if you can empty your lung to the maximum capacity, you can inhale that fresh oxygen into your body to resource your body's function. Some doctors use a post-bronchodilator FEV1 by FVC ratio of less than 0.7, while others use a different approach. And this leads to the discrepancies in the diagnosis, with rates of underdiagnosed as high as 95% and overdiagnosed as much as 60%. And that's a huge difference. I've quoted the paper, the Global Differences paper, on the screen, so you can go back and check it at your leisure. But it doesn't stop there. Many other factors contribute to misdiagnosis. Let's explore those. Exposure to pollutants like smoke, dust, and chemicals play a massive role. In UK, areas with high air pollution levels, such as major cities, are seeing a rise in COPD cases. But there is more. Age, language barrier, educational levels can all make it harder for people to get the right diagnosis. And to add to that, coexisting conditions like asthma, bronchiectasis, heart failure, and even previously treated tuberculosis can mask or mimic the symptoms of COPD, causing confusion for both the patients and the healthcare providers. So, with all these factors at play, it's so easy to see why COPD diagnosis is so complicated in UK. Why does this matter? Because an incorrect diagnosis means a wrong treatment, and that means the condition could get worse. As COPD is progressive, sooner it's diagnosed, sooner the patient can start the right treatment and it can slow down the damage. For those affected with COPD, it's not just about breathing, it's about their family, work, and enjoying every day. And here's something that many people with COPD face that often overlooked: mental health issues. COPD isn't just about struggling to breathe, it's about dealing with the emotional toll it takes on their mind. Many people with COPD often suffer with psychological injuries like anxiety, depression, PTSD, and other mental health challenges, which can go under the labels of DSM-5. And here's the thing: mental health screening is often missed when diagnosing a COPD. People with COPD can become anxious or depressed because of the constant struggle with symptoms like breathlessness or fatigue. This can seriously affect their quality of life and make it harder to manage the physical symptoms of the disease. In fact, in UK, mental health conditions like anxiety and depression are more common in COPD patients, but they're often unrecognized. And without proper psychological interventions, these conditions can worsen COPD symptoms. That's why I raised a petition to UK government and to the local Gloucestershire health authorities to a petition on inclusion of mental health screening should be a part of COPD care. By addressing the emotional and psychological aspect of the disease, we can help the patient cope better and ultimately improve their overall health. So please sign the two petitions, one for the Gloucestershire County and other for the wider UK, which can be seen in any part of my screen right now in the cards. It is one of my previous videos, COPD Reform Care, and the petitions are listed under that. So please do few seconds to go back to that petition and sign the petition to support people with COPD. Now you might be wondering, what if you are in the early stages of COPD? Can you still benefit from treatments like lung rehabilitation? The good news is, lung rehabilitation is not just for advanced COPD. In fact, starting early with the lung rehabilitation can make a big difference. Even if you have mild symptoms, lung rehabilitation can improve your exercise tolerance and reduce breathlessness, which translates to you have more energy to do things in your life on a daily life, like have more energetic to go to work and more energetic to do your exercises and more energetic to spend time with your family and friends. So this is translated benefits, what you get out of your lung rehabilitation, and you'll be able to feel more in control with your symptoms. And so you'll be able to manage your symptoms rather than symptoms managing you. And to back it up, in UK, guidelines do recommend to offer lung rehabilitation at early stages of COPD. So the goal is to help individuals with COPD to slow down the progression, improve their lung function, and feel more control of their health. So what can we do to fix this in UK? In the UK, improving access to spirometry, that is your lung function test, and also creating awareness of COPD and mental health issues, so struggles what the COPD people go through, inclusion of mental health screening alongside with spirometry, ensuring that healthcare providers follow consistent diagnostic guidelines would all contribute to reduction in misdiagnosis rates. And for you, the viewer, if you or someone you know have symptoms of COPD like chronic cough, breathlessness, fatigue, wheezing, talk to your doctor and ask for spirometry. And if you've been diagnosed with one of those labels like COPD or other lung conditions, do talk about your mental health struggles as well, so that the healthcare provider becomes aware of your struggles and they can tailor an appropriate COPD care management plan. Early diagnosis makes all the difference. And if you're a South Asian watching this video, lung rehabilitation can be tailored culturally sensitive way according to your culture. So I've recently published a book on bridging cultures in care, where I explain about how the program, lung rehabilitation program, can be tailored to the South Asian community. Do check it out today. It's in Amazon. Wait, that's not all. In support of Pulmonary Rehab Week, the whole of this week, starting from the 10th of March until the 15th of March, we're offering 15% discount on our Breathe Better program. So don't wait. Contact us today. Thanks for watching and staying until the end of this video. Don't forget to like, subscribe, and share with people you care. Stay curious, stay healthy. Until my next video, signing off, Devi Sundar.